Welcome to another episode of eThekwini Matters. My name is Zimbili Mazibuko, your host. Since the outbreak of MPOX in May 2024, South Africa has reported 3 deaths and 22 confirmed cases. The distribution of cases includes 10 in Gauteng, 9 in KwaZulu-Natal, 1 in the Western Cape, with 8 cases specifically in the eThekwini municipality. Today on the show, we are joined by Muzi Phoswa, a communicable diseases coordinator from the city's health unit. Sibingelele Baba Phoswa on the show.
Ngiyabingelela Mzimbili.
Let's talk about the monkeypox disease, which is now known as the MPOX.
Yes.
Where does it come from? What is it?
Okay, so monkeypox, we first heard of it in 1958 in colonies of monkeys in studies that were conducted in Denmark. And then fast forward to that, we had our first case, of which it was a human case now, of which it was reported in 1970 in DRC. From there, it was now associated with the human, and then that was the first case that we had. So monkeypox is formally known as a zoonotic animal, of which it means that it is transmitted from animals to human. All right, that's when we had the first human case, from animals to human. Further to that, MPOX we had outbreaks of MPOX since 22 to 2024, and there were other human outbreaks, of which they were reported in US in 2003. So we started having outbreaks in African countries, especially in Central and Western African countries, of which about 11 countries that have been affected with the MPOX outbreak. Hence now we started having outbreaks as well in South Africa, as you have just stated the number of cases that we have. So MPOX, it's a viral infection caused by a monkeypox virus, of which now we refer to it MPOX. So this is now not as it known from human to human. So from human to animal, sorry, but now it is from human to human. So it can be transmitted to human.
Now, Muzi, there's a lack of information in regards to how the disease is contracted. Can you explain to the public how does one get MPOX?
All right. So in other countries where there is a lot of contact with animals, and the animals that transmit the virus, as we know that it's zoonotic, so it's from animals. A person can still be in contact with the animal that is infected with MPOX virus, and then can contact the disease in those African countries. But if now a person is infected with monkeypox, and then that person can infect another person through prolonged contact, face-to-face contact, as we are sitting here, and then if we are infected, or one of us is infected, and then they stay for a longer period, and then that person through droplet infection, and then that person can be infected. And also the person can be infected through physical contact. It could be any physical contact. It could be through hugging. It could be through kissing. It could be also through sexual contact as well, when people are having sexual contact. And also it could be through fomites, of which a person who is infected and then they've got rash, and then this infection can live into surfaces, and then you can touch those surfaces through a broken skin, and then that person can be infected with monkeypox through exposure through a virus in different areas where the virus is.
If a person has had MPOX before, what are the chances of contracting it again?
All right. So there are chances of a person having MPOX again if then there is a repeated exposure. So if we are exposed to a person who's already infected, and then there is no guaranteed immunity that if you've been infected with MPOX, so it will never infect you again.
Now let's talk about our role as a city in terms of informing and educating the public about MPOX. What are we doing as eThekwini municipality?
All right. As eThekwini municipality, we've got a section, of which the section that I'm coming from, of which is Communicable Disease Control, or we refer to it as Outbreak Control section. So that section is solely responsible for managing infectious diseases or notifiable medical conditions. So whenever there are outbreaks in our neighboring provinces or neighboring countries, and then we make sure that we communicate that information to our healthcare facilities at eThekwini. So we do that by disseminating information like standard operational procedures relating to the condition, like this one, MPOX. We did that. We circulate information on mostly frequently asked questions, and also we disseminate guidelines on the management of disease, so that in our healthcare facilities, in our clinics, people can have a raised index of suspicion, and then if there are people who are presenting with that condition, we are aware. We would see how are we going to take care of those people in our clinic, and then what are we going to do in also making sure that we prevent the spread of infection, because we need to early identify these cases when they present into our healthcare facilities, so that we can prevent outbreaks. And also we do have a policy or a SOP, of which it talks to infectious diseases, management of infectious diseases, not only MPOX, all the infectious diseases. As MPOX is categorized as category 1, we've got the team, a rapid response team, of which we respond to those kind of conditions. So we've got that in place, and also we do preparedness, of which we activate our rapid response teams, which is multidisciplinary. It include all the stakeholders that are related to management of diseases. It includes doctors, the nurses, all the healthcare workers that are in our health sector. So we make sure also that we do training if there are outbreaks, and then we conduct training to this rapid response team or multi-sectoral team. We do training for those or for those people. And also recently, since this outbreak, we were fortunate that we received support from the provincial communicable diseases section, and also the National Department of Health has supported us to make sure that whatever we're doing, we are supported as a city.
What are some of the myths about the disease, and how do we dispel those myths?
Okay, the myth is that the infection is to a certain group of people, of which it's not the truth. Everyone, if we are exposed to MPOX, like I've mentioned, how a person can get it. So if you are exposed to it, anyone can get the MPOX. Others, they say that it's related to certain gender, of which it's not the truth as well. Any gender can be infected with MPOX. So
take us through the symptoms.
Okay.
If I've contracted the disease,
yes.
if I've contracted the disease,
right.
How long will it take for me to show the signs or the symptoms?
So the incubation period, it means that when you first contact the disease, before you even get sick, it can take up to 7 to 21 days that you develop symptoms. All right. So those symptoms, a person will start to see that they will have fever. They will present maybe with high temperature, and sometimes people they will feel that like that they are tired, and also people they will report headache, and also people will develop a rash. And the rash is very characterized. So that's when the person you can suspect that this person might have MPOX.
Would you like to add anything else about the disease?
Yes, it's just that we need people to make sure that if they see one of those symptoms, and then they make sure that they report to their nearest healthcare facility. We've got our clinics of which they are prepared and ready to manage the patient, and they are open from in the morning from 7 to 4. So people, if then they suspect that they might have come into contact with the person who have had MPOX, and then they can be they can come and then they can get treated, because it is important that a person gets early treatment so that the disease doesn't complicate. So it's very important that people they get that, because we managing the symptoms. If you've got headache, we'll manage the headache. If you've got fever, we'll manage the fever and make sure that the disease doesn't complicate. So it is manageable, and then also we can prevent the spread of disease. And also, if now you know that you've been infected, so do not make sure that you isolate yourself from other people to avoid airborne droplet infection, and also contact with other people. You shouldn't share the room with other people. You shouldn't share the bed with other people if you've been infected. So those are the things that we need to make sure that our community is aware, and make sure that they prevent the spread of infection, so that we can stop this outbreak.
Just out of curiosity, can babies get MPOX?
Yes. Anyone can get can be exposed to MPOX. Like I've mentioned, if you come into contact with the lesions, of the rash that the person have, and then they can have MPOX. And also, if a pregnant woman have MPOX, so there is a risk that if they're delivering the baby or still pregnant, they can transmit the virus to their baby. So anyone can get it, as long as there is an exposure, and then anyone can get MPOX, even the babies, if they are exposed to MPOX.
Thank you very much for your time, Mr. Phoswa.
Thank you.
That was Muzi Phoswa, the city's Communicable Diseases Coordinator. My name is Zimbili Mazibuko, and it's goodbye from myself and the entire team. Don't forget to like, to share, and to subscribe.